Good morning. Breaking news from last night. The U.S. Supreme Court is poised to strike down a more than 50-year statute that guaranteed federal constitutional protection of abortion rights. Politico reported on Monday that its journalists have viewed an initial draft of majority opinion written by Justice Samuel Alito, which circulated inside the court. The ruling reportedly would allow each state to decide whether to restrict or ban abortion. It's unclear if there have been subsequent changes to the draft, according to Politico. The news outlet wrote that the draft opinion is a full-throated, unflinching repudiation of the 1973 decision, which guaranteed federal constitutional protections of abortion rights, and a subsequent 1992 decision, Planned Parenthood versus Casey, that largely maintained the right. Roe was egregiously wrong from the start, Alito allegedly writes, according to Politico. We hold that Roe and Casey must be overruled, he writes in the document labeled as the quote-unquote opinion of the court. It is time to heed the Constitution and return the issue of abortion to the people's elected representatives. We discussed this morning with Cheryl Smith, the publisher of Texas Metro News and iMessenger Media, and from the Baltimore Times, Paris Brown. Good morning.
Good morning.
Good morning.
A landmark decision. I know a lot of people are going to concentrate, and already we see Josh Hawley, Tom Cotton, and others, be rating the fact that this was leaked. The Supreme Court has a leak. Yeah, that's important. But more importantly, we're seeing the fruits of Donald Trump and the Republican Party's labor with the Supreme Court and federal courts, right? More rights. Make no mistake, other rights are now in jeopardy, Cheryl.
Right, definitely. And we say Trump, but we have to go back to Bush and look at all the justices who were appointed and those who are on the side of those who want to overturn Roe and make it a state, making a state. I'm here in Texas, so you know what that means. Right from the giddy up, what's going to happen here in Texas. And unfortunately, there's a lot of pain and suffering that we're going to have to deal with if you let states, if states are able to decide. You're going to have a lot of traveling across state lines.
Yeah.
And
well,
and then you have the internet who tells everybody everything to do, from making a peanut butter and jelly sandwich to they're going to be telling them how to do it yourself. Yeah. And so this has long-ranging implications that goes back to what we must always begin and end with: voting.
Well, Paris, I'm looking over here because I'm going to read a couple of startling facts. Black and brown patients accounted for more than half of abortions performed in 2014. And today, Black women are 3 to 4 times more at risk of dying in childbirth than white women, which we know about the maternal health problems, the maternal mortality rate, right? But also, here's a study that 80% of deaths caused by septic abortions in New York in the 1960s involved Black and Puerto Rican women. In Georgia, between 1965 and 1967, I'm mentioning these dates because there was a run-up to Roe v. Wade, right? The Black maternal death rate was 14 times that of white women. And here's the thing. During this period, nurses reported that sticks, rocks, chopsticks, rubber or plastic tubes, or cotton packing, ballpoint pens, coat hangers, or knitting needles were administered to terminate pregnancies in Black women.
And you said something, and it's a health issue. It's a health issue, not from the standpoint of giving birth, but also you find young women don't get the health care they need at the very beginning, right? And so they'll go months with probably issues that could have been identified early on, and then they'll have a baby and then really risk not only their lives, the child. And so it's not just overturning that. It's really is a healthcare issue, and based on the stats you just provided for our community, for Black women. And so I agree with Cheryl. There are going to be a lot of more deaths, right? In addition to this, trying to terminate their own pregnancies. And then, when you look at social economics, that's a healthcare issue when you're not able to access and pay for the care that you need. So it's just not a decision. This is really, they need to really look at the healthcare issues that are related and ramifications of this issue.
Also in the stats that we put together here, 23 states, Cheryl, and Paris have laws that aim to limit abortion access, including some states that have multiple provisions in place. If Roe v. Wade is indeed overturned, as it appears it has been, or significantly weakened, 26 states have laws indicating that they intend to ban abortions, according to the Guttmacher Institute. 9 states have pre-Roe bans that could potentially be enforced if the ruling is overturned, and 13 states have quote-unquote trigger bans in place, meaning that abortion will almost immediately be banned if Roe is no longer in effect. So again, isn't this more of an issue? I mean, I'm looking at what David Youngblood says. He says our deaths are not motivating factors of public policy. He also says, Cheryl, we are here because white women vote their Negro interests first, not their gender interest.
Well, it's interesting because I said, do not call me for another march. Do not ask me to put on a pink kitty cat hat or any of that, because look at the numbers. Look at what is happening when these very same women go home and vote with their husbands. And that's what is happening. And then, I'm just really frightened by all of this, because I just think about all the implications. I think about the overzealous folks who are working in healthcare, who I come in there because I'm having a miscarriage, and they call the cops because they say I tried to abort a baby. All kind of things could happen with this that are harmful for us when, again, Mr. Youngblood, no, they don't care about. How can you say you care about the Black baby when every legislation, everything that you do from the time that baby is born, you attack?
Well, this is, as already stated, the wide-ranging implications for those who don't look at this issue as, well, it's not my issue. Well, there are so many. This signals that this court, we just had Judge Ketanji Brown Jackson confirm she'll move into that seat in June, I believe it is, when Justice Breyer officially steps down from the court. But you'll still have a 6-3 conservative majority. Paris, how much of this, if not all of it, falls on the Democratic Party?
I think they really need to step up. As you're talking, I'm thinking about you talking about implications. Look at the violence that will probably potentially come out of this, the protests, the local, the bombs, the threats. I agree with Cheryl. We need to go back to, and Dr. Chavez says this all the time, voting. We must vote not only on our local level, but on our state level. I feel that we're very reactionary. Right? We're not progressive when it comes to this is the agenda that's not going to happen. And so we're always responding and we're responding, and we're not strategic. The Republicans are strategic. They started on the local level, Stacey, over a year ago, actually 2 years ago, for this election, to strategically ensure that the lines were drawn. Certain people were that were appointed, and I'm so glad that Biden is now appointing people on the local level, right? So they were very strategic with their circuit appointments. They were looking at this long ago, and we're reacting to something that the Republican Party put in motion 2-3 years ago in terms of strategically getting to this point. So now what happens now, they're bringing it back to the state because they got their judges in the state, right? And so it's been a strategic 3-year plan, and now we're reacting to an overnight decision, which took a while to get in place. And we really, and Dr. Chavez goes back to this over and over again, we must start on the state level, just like they're doing, looking at the appointments, getting voting, understanding the whole legislative process and how this happens, so that we don't end up in spaces like this.
Well, let me say this though, Cheryl. As this what Paris is talking about and what she said about voting, like she said, Dr. Chavez continues to say, vote, vote, vote. I've heard people say, well, we've done it. We got the people in office, but nothing's happened. Look what's happened is what they're really saying. How do you talk to those people?
That is a good question.
Yeah.
That is a good question. But, I want to go, when you think about how do you talk to the people who are there, because I keep asking Democrats, why won't they have a backbone? Why won't they look at things? Because there are little insidious things that happen that, okay, right now, for example, folks should be behind closed doors. So what you said, Paris, about being strategic, we should be working on the 2030 census right now.
Mm-hmm.
Because there were things that happened that caused an undercount, a gross undercount. And you just wonder if the so-called smartest people in the country are planning this stuff, then you have to believe that it's intentional. Well, those numbers were crazy. And so when you talk about redistricting, when you talk about everything that's going on, the plan is in there to have more people who do not look like any of us, who look like Justice Amy Coney Barrett, sitting and making decisions about our life. So it's very action versus reaction. Democrats react, they don't act. There is no plan. And then we get into the ego thing. And you keep saying, let's elect someone, but we have to start at how folks look at each other, and when people are doing something, call them out. Don't try to get someone off of a seat because they've been there a long time. Get them off because they've been ineffective. But then if effective ones, let them stay on there and let them address the issues, and encourage young people to run, but also tell those young people, you got to have your stuff together too. And you have to realize it's not easy. It's not a cakewalk. And more than anything, we have to be able to stand up, because as Black people in America, we are, I guess, this is our time. This is our time more than any time. But shortly, the tides are going to turn, and other folks are going to look at us and say, you were in a position of power like the Democrats, and you didn't do what you need to do. It's our time now. So we have to stop acting like Democrats.
I want to add a couple of things. One of the things, the whole census took place during the pandemic. So they put a pause on everything else, and they deliberately didn't put a pause on that. And I remember saying, okay, if you didn't respond by a certain time, you weren't counted. But even more so, back to what Cheryl is saying, they're accelerating things. They're going to try to get this accelerated. And I mean, they're putting the gas pedal on everything. I mean, when you look at Amy Barrett, I mean, she was literally confirmed almost at midnight. They had the lights on it it was dark. And she got confirmed like so quickly, like overnight. And so they really push their agenda. And I agree, when we have power, we don't push our agenda. We want to work across lines. And you look, 2 appointees right there of Trump, right? And they're part of this 6-3 conservative decision. So we've got to really, I agree, push our agenda.
Oh, gosh.
Listen, I just think about her walking into the room. Somebody in that room of justices had to say, what the heck is she even doing up in here? But a lot of them don't deserve to be up in here. Maybe that's it. A lot of them don't deserve it.
Well, before we move on, we do have our president and CEO with us, Dr. Benjamin Chavez. Dr. Chavez, good morning.
Good morning.
Good morning.
So good to see everyone. And once again, these are the vital issues that impact the quality of life of African Americans. But it just shows you that every vote counts, every election. When we say that this election is the most important election of our lifetime, every election is the most important election of our lifetime. And we should not take anything lightly. Voting has consequences. And that's what we now see at the Supreme Court. Mm-hmm. But, it just means that we don't stop fighting. We have to fight harder.
Mm-hmm. Well, Doc, Cheryl, and Paris, before we move on to mental health, we just want to note that, let it be known, we were at the PGA's, PWCC's Minority Golf Championship, now in its 35th year, and features more than 30 teams representing HBCUs and Hispanic serving institutions and other minority serving institutions from across the nation. It's sponsored by PGA WORKS, Comcast, Castle Oak Securities, Bank of America, and the Union League of Philadelphia. The 54-hole stroke play event is being played, I should say, on two courses: Union League Liberty Hill and the Union League Golf Club at Torresdale. A field of 202 participants are divided into 5 divisions, and it's such an exciting thing to see these young players, particularly from the HBCUs, who are really getting an opportunity to show just how good they are at this game. There's a lot of things happening over in Philadelphia this week with this. Gary Player, the South African former champion, was there to greet and talk to the HBCU students. We had some great conversations with Gary Player, as well as others with the PGA of America. We will bring you more of that. Scooter Clark, actually the championship director at PGA WORKS, was also on hand, and we had a great conversation. We're going to talk about more of that in the days to come, and you can go to the Let It Be Known's YouTube channel to see full interviews with Gary Player and Scooter Clark. But right now, Black teens and mental health, it's an issue that is really, really raging. The mental health of Black American youth was in crisis long before COVID-19 devastated the world, but no national public health crisis was called. Dr. Amanda Calhoun, an adult child psychiatry resident at Yale Child Studies Center at the Yale School of Medicine, wrote that in 2019, the Congressional Black Caucus Emergency Task Force on Black Youth Suicide and Mental Health released a report documenting the alarming increase in Black youth suicide rates. Dr. Calhoun noted that the suicide death rates among Black youth have been increasing faster than those of any other racial or ethnic group in America, and Black youth under 13 are twice as likely to die by suicide compared to their white peers. Calhoun also cited preliminary federal data, I should say, which noted the suicide rate for Black girls and women ages 10 to 24 increased more than 30% in 2020 and by 23% among Black boys and men in the same age group. This is a crisis, Cheryl and Paris and Dr. Chavez, that needs to be addressed, not just during Mental Health Month, but it needs to be addressed and addressed yesterday.
Oh, definitely. And this is something also that has been exacerbated by COVID.
Yes.
And I'm glad to see more of us are seeking professional help. Of all ages, we need it. And when you look at the numbers, there were certain things when I was growing up that when you heard it on the news, you didn't think it was us. You said, oh, no, that's not us. Kids killing their parents or killing themselves. But now it is more and more of a problem. And we can't just look at young people right now, I'm talking about specifically, and say, oh, they're just bad or they're just acting out. And I do think we have to accept some of the responsibility for some things, because there's an adequate way of preparing our young to deal with things. And instead, we have tried in a lot of cases to shelter them and don't want to. So when a young child gets called the word, they call it other things. They call folks the name of what Dick Gregory's book, nigger. When there are young people who are devastated when they are called that. And I can remember when I was called it, it was, there was a way that we handled it, but it didn't have the impact that it's having on our young now, because they aren't prepared to cope.
And I agree with Cheryl. Growing up, you were told about racism, right? You were told this is how you behave. This is what's going to happen when you go out in public, and this is how you respond to it. So I think also that they were better equipped to handle it. And then, of course, there's so much exposure to social media. There's so many people that can get at our kids directly. And you're absolutely right. I was amazed at just when you look at this divisive environment and the racism and all of the things, they're coping with that at a very young age. Why? Because they're exposed to so much. Yeah, to a degree, we didn't have social media. We didn't have so many things that exposed them to at an age so young. I mean, even as an adult, you get like you said, you get called a name, but we know how to process it, right? When we're like, they're the ones with the issues. It's not us. But as a young child, I mean, you got young. I read a story about a child who killed themselves. I mean, they were like, what, I think, what was it, 8 years old? Because she couldn't cope with a lot of we've as Black people, we got a lot of stuff to deal with. We know how to process that, and I think we need to better prepare our children. I think that we as African Americans, we need to declare it a health crisis. Until white folks are affected by it, it's not really designated as a health crisis. When you look at the opium health, it was a health crisis after they're affected. But I think what affects us the most as a community, we need to declare it. And what's our plan? And you're right, we need to embrace them. There needs to be, and I'm so glad there are more supportive groups to help our youth.
Well, also to go along with what Paris is just saying, Dr. Calhoun, who we cited earlier, says many suicide predictor models continue to list white race as a factor that increases risk of suicide, and the myth that Black youth do not commit suicide persists. That's a problem that we in the Black press, I know Dr. Chavez mentioned just the other day, some issues with we have to highlight the issues of our teenagers when it comes to mental health. There's a story on blackpressusa.com and many of our member papers that you can read about currently. But Dr. Chavez, this is a problem that when they still label it as more predictors are still calling it, a white thing.
Yes, I'm in Arizona this morning, so it's very early here. But the reason why I'm here, I'm speaking this morning at 8 a.m. Pacific time on mental health and Black America. And I really want to thank the Phoenix Suns and others for sponsoring this vital program. I just saw Clovis Campbell, the publisher of the Arizona Informant. He'll be with me this morning. And just let me say, this is a national problem. It is a crisis. And as our guests have noted, and the study shows that this is pre-COVID. COVID only made it worse. Now, as we begin to come out of COVID, the trauma of isolation, the trauma of not having the coping skills passed on from one generation to another. But I would also say that the trauma of social media, our young people, children now, as from 6 years old, some even younger, have devices that they get information. And a lot of people are bullied into even thinking about suicide because of the negative trauma that they get in terms of information. So I think this is where the Black press comes in. And I hope that we not only do a series on this, on the mental health of our community, Stacy, but also that we offer solutions. I think the professor who did the study is great. I call on all of our HBCUs. We should be doing our own studies. We should be come up with our own recommendations of how to make sure our children are our responsibility. All of us know when we were young, when all of us were young, we had not only mothers and fathers or guardians and grandparents, the whole community looked after there was no child in our community that was excluded from the embrace of the community. Now it's just the opposite. We have people who live next door who don't even know the names of their next door neighbors. And so our sense of community, our sense of peoplehood, our sense of yes, race, our sense of they used to, people used to be called, well, you're a race man. But that doesn't mean you're a racist. No, that means you do whatever that protects your ethnicity, that protects your race, that protects your culture. And that's why the Black press is so important. We have to not only inform our people of the crises, but we have to also inform our people of the solutions to the crisis, as Malcolm would say. that we have to be part of the solution, not just describers of the problem.
Yeah, and 30 years ago, Cheryl, most health experts reported that primary concerns about teens were things like a teenage pregnancy, smoking, drunken driving, binge drinking. But now we see that in 2022, it's major depressive episode. There is anxiety. There is the tendency toward suicide.
Right. And that, well, look at where what was happening. I grew up in Newark, New Jersey, and I know that street I lived on, Dr. Chavez, where we knew everyone in
Yeah.
every house on the block. And but then also we have to look at what is happening with our young, and Paris, you mentioned this about reacting. We need to be having conversations in the schools. Yes, they bring the grief counselors out there after something has happened. But
Right.
what about when folks are going through? It should be a part of the natural orientation. And I thought we were going to be a kinder, gentler America because of COVID, and people are so dysfunctional and they're so angry, I guess, because they're we have when you take social media and you take the pandemic, which I say the Black community is always in a state of pandemonium. Folks don't know how to cope, and their coping skills are making them do things that
Mhm.
are very unhealthy. So, what do we do about this? And we're looking at the this study and looking at NIH and other organizations that are looking into mental health. We can't wait for anyone to save us and to save our children. We need to be addressing from a very young age, helping them to cope with skills. Parents have to start not speaking for their children. How many times have you met a teenager and they're with their parent and you ask the young person, "How old are you?" And the parent answers. It's those little simple things that start, when we need to be letting our children speak for themselves, let them learn how to have conversations with more than just their thumbs.
Yeah, well, again, Paris, they has already really been stated here, but there was a time where we really lived by that. It takes a village.
And I think that one of the things, and again, what Cheryl talked about and Dr. Chavis, is as African Americans, we have very unique experiences. We have experiences that other ethnicities do not have, and so it's not a blanket, right? We have to come up with strategies and ways to address our needs in our community, and be able to communicate that. As we're thinking, I remember growing up, we had home ec, we had things in school, and I think it's necessary to, maybe we need to go back with life coping skills in high school. I remember learning how to balance a checkbook, cook, taking care of home. And so, we have very unique issues that we have to begin to address on a school level. You remember those, and I agree. We it took a village. We knew everyone. I knew who lived next door, and we laugh. I mean, today, even when I move in a place, I know everyone that's in my building because I make it my business. And you know what? As a result of that, they take care of me. They're like, "Oh, Paris, you left your door open," or "Paris, you left your keys in your car in the door," and they'll come and tell me. And it's because I know everyone in the community, to the left and to the right, and we got to get to know our children.
Well, anyone experiencing suicidal thoughts, anybody who thinks that someone may be in trouble in that sense, the National Suicide Helpline, Prevention Help Lifeline is 800-273-8255. Again, that's 800-273-8255. And please, we urge you not to wait until it's too late. If you see, as they say, you see something, say something, help someone who is in need of help. There's many organizations, including NAMI, that helps those with who struggle with mental health. NAMI is headquartered in Washington, D.C., but they have branches around the country. That's NAMI, and you can go to NAMI.org for more information. Dr. Chavez, we have about 45 seconds, please. Let's end this today by telling folks what they can expect at the NNPA's convention this summer.
Yes, freedom, justice, equality, and equity. The NMPA's 2022 National Convention in New Orleans, June 22nd through the 25th. We are at the Hilton Riverside in New Orleans. Please go to nmpa-events.com to register. The Honorable, great, fabulous Stephanie Mills is performing. We're going to have great workshops, particularly to enable our publishers how to increase their revenue from digital. I was just talking to Karen Carter Richards, our chair, yesterday, where we're going to really have a platform to deal with a lot of these issues, including the issue that we're talking about this morning, the mental health of our community. So please come out and join us as we celebrate the 195th year of the Black Press of America.
And we'll let that be the mic drop. We will definitely see you tomorrow on Let It Be Known. Thanks for joining us.